My name is Tunde Okewale. I'm an obstetrician, also a gynecologist. I'm also a fertility expert. I am the CEO of St.Ives Healthcare Organization. We started St.Ives in 1996, that's roughly 22 years ago. I've been practicing medicine for over 30 years, and I've been a gynecologist for over 25 years. My main specialty or subspecialty is fertility medicine. Infertility is a very serious social issue anywhere in the world. 1 in 4 couples find it difficult to achieve pregnancy. And when that happens, it's not only them. It affects them, it affects the family, and it also has effect on the community. And that's part of the reason why I'm committed to get as many women as possible, or as many couples as possible, pregnant in the kind of work I do. We've had many successes. As at the last count, we've had over 2,000 babies through our IVF unit, and we've lost count of the number of babies through normal delivery in our unit. And I keep advising my patients, especially newly married couples, that their best chance of getting pregnant is in the early years of their marriage. For a woman, as a woman grows older, the chances that she would achieve a pregnancy starts to decrease. And it starts to decrease at around age 35. So if you're looking on getting pregnant easily, then it's very important that you try and achieve it before age 35. Infertility, as it's defined, is inability to achieve a pregnancy within 1 year of actively trying with unprotected intercourse. And in a newly married couple, it is very important that they try and achieve this as early as possible during their reproductive life, and not leave it too late. One funny experience that I'd had in my practice as an IVF specialist, fertility specialist, was an incident of a couple who have tried to get pregnant in different hospitals, in different countries of the world. She lost confidence in herself, or the couple lost confidence in themselves, and decided to go the surrogate way. That is, somebody should carry the pregnancy for them. And I tried to convince her that she should be able to, but she said no, she's had previous IVFs that failed. Eventually, they agreed to use a surrogate, and also for her to use her own self to carry the pregnancy. We went ahead with the two, and the strangest of things happened. The surrogate carried a triplet, and she carried a twin pregnancy. So suddenly, from a 0, no baby, they suddenly had 5 babies at a go, same year. That was quite funny, and each time the couple still calls me, we still talk about that. They're doing very well with their 5 babies. Yes, one of the philosophy of care, or the philosophy that guides our practice in our fertility unit again is, yes, age is a barrier to getting pregnant, but it's the fundamental right of every woman to have a child if she so wishes at any age that she wants. And that was part of the reason why the woman that was 60 years old, who is the oldest IVF mom in Africa, when she approached us, that she and her husband, they wanted a child of their own. That was why we agreed at that point in time, and God helped us. And she had a successful pregnancy and delivery, such that the BBC and the CNN came to interview her, and she's all over the net. It is the right of every woman to have a child in her lifetime, and age should not be a barrier. Because having said that, nobody questions a 70-year-old man if he decides to have another child. So we believe it's nothing to be looked upon as if it's not their rights, let me put it that way. When we started the fertility journey in Nigeria, in terms of providing IVF or assisted conception techniques to couples, one of the major drawbacks is cost. The cost of doing an IVF cycle is a bit on the high side. Not only in Nigeria, it's worldwide. It's the same thing in the US, it's the same thing in the UK. Why? Because the equipment and the technology is high-end technology. But having said that, whoever wants to achieve a pregnancy through IVF, or put in another way, IVF is not the most expensive medical procedure. It's less expensive than kidney transplant. It's less expensive than cardiac surgery. But because infertility, you cannot really term it a disease in the real sense of it. It's not a life and death issue. So the cost comes into fore in such situations. What we realized, we came to a conclusion on in Nigeria is, if IVF is going to be available to a large number of people, then we must find a way of reducing the cost. And that's where we started pioneering the issue of low-cost IVF in Nigeria. A foundation got interested when we started advocating for this, Ives Medicare Foundation, and at regular intervals in the year, they assured us that they will give a discounted, that we should offer a discounted IVF to indigents, Nigerians, who so wish at particular times of the month, of the year. For example, in our Ikeja branch here, anyone that registers for IVF in February with us, they usually get a 50% discount on the cost of the IVF. The foundation pays us. The patient doesn't have to know where the money is coming from. The foundation pays us and the patient pays half of the cost. We do that in August in our Ikeja branch. And majority of our 2,000 IVF babies came from those schemes. In fact, the 60-year-old woman, the oldest IVF mom in Africa, came from, well, as a result of benefiting from that particular scheme. The idea is the government should look in the direction of fertility. Fertility is a major social issue. I know the government is more concerned about fertility control. They talk more about population explosion and fertility control. But infertility is a big social problem. Fertility is not a problem between just the husband and the wife. It goes deeper than that. It disrupts families, it results in divorce, it results in separation, results in polygamy, results in having extramarital affairs, results in illegitimate, so-called illegitimate, having illegitimate children outside. So it's a major social issue. And the government must look in that direction, like other governments in other parts of the world do.